Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. Let's see in this video the tobacco dependence. Tobacco causes dependence, both physiological and psychological, and can represent the path towards other drug addictions, since a young smoker has a probability 100 times more likely to try marijuana. According to the World Health Organization, WHO, smoking claims a life every 8 seconds. Research has shown that people who start smoking during adolescence, as is the case in more than 70% of the cases, continue to do so for 20 years or more, will live 20 to 25 years less than those who have never tried tobacco. Out of every 1,000 deaths that could be avoided, 1 is due to illegal drugs, 2 due to HIV, 20 from traffic accidents, and 150 from smoking. Among all the smokers in the world, about half will die early from tobacco, and increasingly the age at which young people start smoking because of tobacco is getting younger. Start smoking by social learning. Therefore, as reflected in the data on tobacco use, it is the leading cause of preventable disease and death, and it is the leading cause of preventable disease and death, and the leading cause of preventable death. It is good to know that in tobacco, multiple substances have been found, which in large part are highly harmful to health and which stand out for their harmful effects. TARs are responsible for 30% of all types of cancer: bladder, kidney, pancreas, stomach, etc., and 90% of lung cancer, 22 times more risk of cancer than a non-smoker. Carbon monoxide, which is responsible for more than 50% of cardiovascular diseases, 4 times more risk of heart disease than a non-smoker. Nicotine, which produces chemical dependence with the capacity to generate dependence comparable to very aggressive drugs. However, smoking, like other dependencies, presents a strong abstinence syndrome after 24 hours if the ingestion is inhibited, which nevertheless subsides relatively quickly. The serious problem lies in the psychological dependence, which renders ineffective almost all therapeutic protocols if they are not accompanied by a rationally firm decision by the patient to quit smoking. It's a chronic addictive disease. It is said to be an epidemic problem because of the large number of people it affects. Tobacco is a drug that produces more dependence in the user than heroin or cocaine. The mere fact of cutting it out produces a discomfort known as a withdrawal syndrome. The smoke of a cigarette contains more than 4,000 chemical substances. Among the most studied and toxic are nicotine, carbon monoxide, eye and upper respiratory irritations such as phenols and toluene. Carcinogenic substances such as nitrosamines and tars. Smoke is especially harmful to children and pregnant women, although the main casualty is the smoker himself. When you inhale the smoke coming from a cigarette, you are introducing in your organism at least 4,000 identified toxic substances that, together with other pollutants from the air you breathe, make a bomb with delayed effects in your body. Do you still want to continue smoking? If it is yes, you know what awaits you. If it is no, you can take advantage of a number of benefits. Let's look at them. Benefits of quitting smoking. We all know that tobacco is harmful to health. Quitting smoking is always accompanied by gains, physical, social, psychological, and economic. Short-term benefits. Increases agility. Improve the sense of taste and smell. Greatly improves body image. Represents an economic saving. Medium-term benefits. Increases lung function. The teeth and facial skin become much clearer. Reduces the risk of coronary heart disease. Eliminates irritating morning coughs. Long-term benefits. Risk of heart attack equals with non-smokers. At 5 years, risk of death from lung, bladder, and laryngeal cancer is also reduced. After 15 years, the risk of disease will be identical to that of a non-smoker. The World Health Organization, WHO, estimates that currently about 5 million people die each year as a result of smoking. This figure could reach 10 million by the year 2030. Quitting smoking is going to be the most important thing you can do for your own health and well-being. It is hard, and in general, the longer you have been smoking, the harder it is to quit. But it is always possible to do so. The experience of thousands of people who have succeeded endorses it. Surely, in your circle of friends and family, there is someone who has already succeeded. If you are watching this video, surely you are thinking about quitting smoking. Surely you find countless reasons to quit smoking. The content of this video will help you to do so. If you're interested in learning more about clinical hypnosis, watch our next video, Tobacco Considerations. Remember to study the description of this video, where you can find a link to free training classes on clinical hypnosis, with several free ebooks. If you have questions, ask them in the comments area. About this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.